Yeah, just her. She's
Oh, I'm sorry, that's so hard.
Yeah, it's been hard. It's been hard for a lot of other things, not just that. My brothers are doing bad things, and it's bad.
Yeah.
I mean, it's really bad. So, anyway, let's go have fun. I lost the sound in here.
Yeah, I don't hear anything. Oh. Okay.
So welcome back. My next guest has been on the show with me several times before. I have Pamela Matthews, and she's the owner of Spectrum Thermagraphy. Welcome back to the show. I want you to tell everybody a little bit about yourself and what you do, and what you do is very special. So tell them what it is, because not everybody knows what it is.
No, a whole lot of people don't know what it is. Thermagraphy. I'm a mobile thermographer, so I have a camera and my computer, and I go to about 20 different clinics, usually once a month to each clinic. And I do breast scans, half body scans, and full body scans for men and for women.
But not just breast. I mean, it's a
No.
lot more than that.
Yeah, it
So
really is.
What is it?
It actually, thermography shows inflammation in the body, and inflammation is the beginning of any disease. So it'll show up arthritis, it'll show up chronic fatigue, it'll show up fibromyalgia, any kind of muscle issues, nerve impingements, dental problems, sinuses, thyroid, anywhere where there's inflammation.
And it's safe.
Absolutely safe. No radiation, no pain. I just take pictures.
So that means that there's no pain, there's no, if you're doing a breast thermography.
No compression.
No, nothing like that.
No.
And here's what you're doing. Now you have to tell everybody, because I normally don't talk about cost on the show, but
Right.
because it's unbelievable, I want you to talk a little bit about your prices, because it's great. Listen up.
Sure. No, a breast scan, the first time breast scan is $195. And then they recommend that the patient has another one 3 to 4 months later, because cancer cells double in number in 90 to 100 days, and all women's thermal patterns are different, kind of like fingerprints. So if that second scan compares to the first one, it creates a stable baseline, and then you just have an annual scan. So a half body scan includes the breast, and that's $295, and that's about 18, 20 pictures, and includes the abdomen. And then I also do the bottom half if you have issues with hips or knees or ankles or feet, and that's the same thing, $295, but that also includes the abdomen. And then a full body scan is $395, and that's about 35 pictures from head to toe.
And you're offering for anyone who calls in during this segment, during our show,
Yes.
you're going to get 50% off coupon just for that.
Yes,
So-
any scan.
On any scan. So our number here is 602-277-5369. Toll free, it's 1-866-536-1100. How many people out there have to pay out of pocket? You know, for, I mean, a lot. Go ahead.
Most. We were picked up by Aflac, and they are contributing $75 towards the breast scan if you're on one of their pre-cancer screening policies. And then Aetna and Blue Cross Blue Shield, depending on your policy, has a little bit of compensation, but generally it's out of pocket. I do have the receipts with all of the codes for thermography if you want to try to get submitted to your insurance company.
Right. Now, so here's the thing. Anybody who's dealing with any kind of pain issues, if you haven't had a mammogram in a long time, or because you can't afford it, or because it's out of pocket, or you're putting it off because you have to take care of your kids first, or whatever it is, you can call her. You can either call her direct, or you could call here, and we're going to give you a 50% off coupon just for that. And you're valley-wide,
Yes,
so
I
you
am.
go to different clinics. Let's talk about that.
Yes, I go to about 20 different clinics, Mesa, Anthem, actually I drive to Prescott too, twice a month, Chandler, in Phoenix, Scottsdale, Peoria, Surprise.
Okay. Now, on your website, can they see where you're going to be?
Yes,
Kind of
on the
thing.
website under dates, it'll list all the clinics, where I am and what time I'll be there, and you call the clinic directly to make the appointment.
Okay, so the website is spectrumthermography.com. thermagraphy.com. And any new clients for the month of October, you're giving 10% off.
Yes, for I like to call it breast cancer awareness, or not cancer, but breast awareness month rather than breast cancer awareness month.
Okay, and which is October, so
Right.
for the month of October, she's doing that. And anyone who calls in between now and the end of the segment, I'm gonna let you call throughout the rest of the show for it, because this is something I think everybody can. It's not just for you guys out there. You guys also have men boobs too, but it's also not just as necessarily for breasts. It's anywhere in your body that you're dealing with any type of an issue.
Yes.
Okay? So again, it's 50% off by calling here, 602-277-5369. Toll free, it's 1-866-536-1100. You can also call her direct. It's 480-226-8289. And again, it's spectrumthermography.com. And I'm telling you, anyone that's listening to this should call in and get this done. 50% off, it makes it like nothing practically. I mean, really, when you consider. So again, 602-277-5369. So, how do you differ then from all the others out there? Because you don't press? I mean, what is it?
Well, the difference between mammography and thermography is a mammogram shows a mass, and it doesn't know the difference between a cyst and a tumor or a calcification or fibrocystic disease. Thermography actually shows activity in the breast, so it shows the vascular changes and the lymph changes in the breast, and that's why it's so important to have this annually, so that they can kind of chronicle what's going on and what changes are happening in the breast.
How about for pain? How do you see this? How do you see the pain? Well, who reads these different? Who reads the results?
Yes, the images are read by EMI, which is Electronic Medical Interpretations, and they're all MDs that are certified in reading thermography. So I send the images to them. They send them back to me within 2 to 3 days with a full report that I make PDFs of and send on to the patient and or their medical advisor if they ask me to.
And if they have pain, it's going to show up as like a hot spot, right?
That's inflammation, yes. It
Okay.
shows up red.
Right, and so there's a lot of people out there that are dealing with a lot of different pain issues, so this is a great way. I know for me, my back was out for like 4 years, okay? Because I had one of those sciatic nerves.
Ouch, ouch.
And I'll tell you, and I am coming, because I'm telling you, the idea of having to go for a MRI, which would be the same sort of thing, right?
Right.
I mean, it's
Shows
obviously
inflammation.
different.
No, it is different, but
it's-
yeah.
Oh, go ahead.
You would see inflammation. I know I had one gal who owned a spa, and she was getting massages for a similar problem. And when we did her full body scan, they saw places that were hot spots that the massage therapist was then able to treat as trigger points and knew exactly where to help her.
Right, but so many people, they have it out of pocket that they're paying, and they haven't got taken care of themselves. This is perfect, guys. And you're calling in here, you're getting a 50% coupon off from me. So 602-277-5369, and toll free, it's 1-866-536-1100. Check out our website. It's spectrumthermography.com, and you can go there and see all the different places that she'll be, and you can pick a place, call it, and make an appointment. And you can also call her direct if you want to talk to her. It's 480-226-8289, or call here at 602-277-5369. Okay, so I think people need to have a second breast exam, just because the first one you never know, right? Is that the reason?
No, the first one they would see something obvious, but the second one they're able to see if there's been any changes in 90 to 100 days. A cancer tumor of the breast has to have a new blood supply. It's called angiogenesis, and that new blood supply shows up as hot on the thermogram, and then there's also a chemical in our bodies that keeps those vessels open that also creates heat. So in some cases, they can show the beginnings of a tumor 8 to 10 years before it's large enough to be seen on a mammogram. But I do want to be clear that this does not replace a mammogram. My feeling is that we have all of these tools, and if this is so rampant, let's use them all. It may cut down on how many mammograms you need, because if there's nothing seen on the thermography, and you don't have any physical, lumps or bumps that you're feeling, there really isn't a need for a mammogram, but it doesn't replace it.
And is any insurance cover it, or is it all through just that Aflac and that's it?
Aetna, I think, does have some. That's rumored, and then it's also rumored that next year, perhaps, there will be a couple of companies that are actually going to give some compensation for thermography.
Both men and women?
Yes.
Both men and
Both
women.
men and
What do you
women.
find you most of the women because or do you find you're doing a lot of people with pain?
Interestingly enough, I find more pathology in men that come, and I'm not sure why, perhaps because they don't go to the doctor as often as women do. But I know one gentleman had the palms of his hands were just red like gloves when I did his hands, and I never seen that before, and I didn't know what it was. When the report came back, they asked him to check his glucose level. He had type 2 diabetes before he had any symptoms.
She's valley-wide, and her phone number direct is 480-226-8289. It's spectrumthermography.com. You can go up there and look at where she's going to be and set up an appointment. Call throughout the rest of the show for this. You're getting a 50% coupon, already fabulous prices already. So 50% off 602-277-5369. Yes, and I know you got some calls too. So, excellent. Yay, yay. So thank you very much. You got a videotape on me.
Wonderful.
And if you want to, you can do a weekend if you want to. It's $50, but you don't have to. But that would be your choice. I do the